Thank you, thank you. Hi everyone, welcome back. Hope you've had some lunch and time to have a break. We're going to start with our next panel discussion, which is all about healthcare. It's a sector which globally is being transformed by new technologies with advancements in both medicine and technology improving both patient choice and outcomes. So our next panel discussion will focus on this and the investment aspect, which is so critical to accelerate and progress this trend. Please welcome our chair for this next panel, Richard Burge. Richard's varied career has seen him lead 4 multi-million-pound organisations as chief executive over a total of 18 years. He's currently chief executive at the London Chamber of Commerce and Industry. Please welcome Richard.
Good to see you all. We're going to crack on now. It's just after lunch. So we talked to the panel. We all decided, rather than talk, wouldn't it be a good idea if we did a bit of cardiovascular exercise just to get ourselves going? So I want you, the look of horror here on the front row is worth seeing. No, we're going to get on with this. Now, accelerating health is very important. It's a huge area of collaboration between the Arab world and the UK. I mean, obviously, we're facing major change through digitization of health, through AI, through telehealth, and through e-health services. It's a huge range of investment. There's major research going on. The largest area of research in the world is on health and medicine. And a lot of it's happening in the UK. A lot of it's practiced and developed in the Arab world. And then finally, there's the whole world of well-being. So that's not just primary healthcare to make sure we don't get sick in the first place, but the combination of physical health and mental health, not just in the workplace, but at home, in the very tense and difficult world we live in. How do we keep ourselves well? This is a big area of discussion, so I'm really pleased we've got 4 very exciting panelists to talk to you about their involvement in it and the critical issues they face. At the end, we're going to have a bit of a conversation amongst us. I want you to join in. If I ask you to join in and ask a question, can you actually ask a question? We don't need speeches. We'd quite like a quick question to stimulate the panel to come up with an interesting discussion. So without further ado, I'm going to ask the chair of the Tunisia Chamber of Commerce, Jed, to take to the podium.
Thank you, Richard. Your Excellency, Ministers, Ambassadors, honorable guests. Let me first thank the ABCC great team, and especially the Secretary General CEO and the Vice Secretary General and CEO for the tremendous work done for the organization of the event and for the quality of panels and debates. With the advent of the recent COVID-19 global health crisis, humanity has become aware more than ever of the challenges facing the health sector. It is necessary to make individuals aware that health is wealth. The pandemic has brought the global economy, The pandemic has brought the global economy to its knees and paralyzed the entire production chain. The health issue has indeed taken precedence over other causes. However, the sanitary system could not stagnate. It had to evolve in order to adapt to new technologies. This has given birth to new concepts, namely e-health, telemedicine, and artificial intelligence. The digital revolution was well underway even before COVID-19, but disruptive technology needs to be widely adopted before society adapts to it. However, the pandemic and subsequently enforced lockdowns helped catalyze the transition to digital ecosystems. Digitalization was critical in sustaining supply and demand in the wider global economy, thus preventing an irreversible shock. In healthcare specifically, the pandemic accelerated digital adoption, which has resulted in a significant transformation in healthcare delivery within a short period. Digitalization and the introduction of telemedicine services have remarkably improved access in delivering healthcare services. Digital tech is making healthcare proactive as opposed to reactive, enlarging and enabling access to quality healthcare for communities that were traditionally underserved or marginalized. All these benefits are over and above the way digital healthcare enabled the delivery of services to previously hard-to-reach communities with the same level and quality of high-end healthcare facilities. The full impact of digital health lies in its ability to both foster inclusion across age, gender, race, and to close gaps in primary healthcare, driving productivity by freeing physicians from repetitive tasks and allowing them to focus on care and spending more time with patients and moving to personalized medicine. However, to achieve true health equity, we need to rethink the fundamentals of integrated healthcare and technology, and not just resort to digitalizing traditional models of healthcare delivery. We need to evaluate and understand the needs of underrepresented populations and create tailor-made digital solutions that will deliver precise, focused health interventions and address their immediate problems. One way is to assess the shared needs of particular groups and curate solutions using digital tools that will address the challenges and increase efficiency of healthcare. At the same time, we need to be mindful of the barriers of digital access and literacy that may present challenges to health equity. Globally, while a record 4.9 billion people used the internet in 2021, around 37% or 2.9 billion people are still offline. A deep understanding of the interaction of social, cultural, and economic realities is needed to overcome barriers to technology access that aggravate health inequalities. We need to address connectivity, affordability, and accessibility with appropriate investments, innovative and inclusive solutions, and policy support in order to bridge the gaps and create a sustaining holistic healthcare solution. The TBCC, the Tunisian British Chamber of Commerce, that I have the honor to chair, strongly believe that thanks to its diversified resources and young population, the African continent will address the huge challenges of the Millennium Development, adopted by the United Nations and endorsed by most of African countries. Namely, innovation in education and health will be the main driver of sustainable growth and equal welfare. Tunisia, as part of the Arab world, is the gateway to Africa, as its development policies are mainly focusing on human capital through education and health, all along with IT. All this makes Tunisia ideally positioned to address these challenges. In 2018, Tunisia enacted the Startup Act as part of the government's strategy to boost socio-economic development and expect technological infrastructure. The Startup Act has effectively increased the number of startups, especially in the high-tech sector, making innovative entrepreneurship in Tunisia more competitive internationally and potentially increasing economic growth and employment, especially among youth. With at least 17 tech hubs and a large number of funding and monitoring programs, Tunisia is one of the most dynamic locations for startups on the African continent. In November 17, Tunis was selected as the location for the African Union planned Digital African Excellence Center, which will be in charge of training African government officials and private sector managers in the digital sector. Striving for higher performance in healthcare services delivery makes a favorable ground for the generation of new types of high potential and fast-growing businesses, expected to create more job opportunities for young graduates. Tunisia has already all the ingredients of a national innovation system that produces significant research and development in the medical sector. It is already showing up an interesting science, technology, and innovation potential to be valorized. Finally, as a lawyer, I cannot help but emphasize the challenges that the telehealth raises, mainly the liability risks such as the protection of data, patient confidentiality, and misdiagnosis. In addition to that, physicians and medical staff who are adopting telehealth have further administrative considerations. Thus, users have to be aware of telehealth laws and regulations in their respective states, as well as in the state of every patient in their telehealth platform. The legal professions will definitely be strong allies in this transformative journey to help healthcare and IT experts navigate through these challenges to achieve more equitable healthcare ecosystems for the global population. Thank you very much indeed for your valuable attention.
Thank you very much, Jed. I was really interested with Jed, two things he focused on there. At the end, he talked about risk and the legal side. He's a lawyer, he's bound to. But actually, most of it was a very enthusiastic and positive presentation around job opportunities and employment opportunities. And the second thing I thought, you used the word health equity a lot. Very important phrase. We don't actually use the new advances of healthcare, particularly its digitalization, to create greater access to healthcare for entire populations, then we're actually not going to make people as productive as they could be. So what about health as an investment opportunity? Really pleased to, we're going to learn a lot about that now from Jess. Thank you, Jess.
Thank you. Hello, everyone. Wonderful to be here today, and thank you so much for the opportunity to speak. So I am a health tech investor. I work at an organization called Octopus Ventures. First of all, I'll talk you through a bit more about who we are and also why we do what we do and what we're excited by within health technology as an investment vertical. So as a group, we were founded in the year 2000, actually by 3 entrepreneurs, 2 of which currently run the business today. We have 700 investment professionals and we have 12.6 billion in assets under management. And proudly, we're a private business, 30% of which is owned by our founders and employees. From an investment perspective, we invest in the people, the ideas, and the industries that will change the world. We categorize this into 4 main areas. First, renewables. We're one of the biggest investors into renewable energy in the UK. We also have our own energy company, of which is the 3rd largest in the UK, managing supply for retail customers. We're proudly as well the only platform in the UK from which you can buy 100% renewable tariff from. We're also a large investor into real estate. We have 4 billion in AUM invested into various types of real estate. Venture capital, most excitedly, where I work and focus. We've got just over 2 billion in AUM invested into venture capital investments. And then lastly, just under £500 million invested into sustainable infrastructure, which includes electric car charging vehicles and energy storage. So in short, Octopus Group is a £12.6 billion pound asset manager. We invest in innovation and technologies that will help drive today's industry and economies into the world of into the economy of tomorrow. And we have institutional investors, of which cover many countries and geographies, as you can see here, and a next generation energy company. And we have huge ambitions. So 5 years ago, we set up a team and a strategy to invest and expand into Australia, where today we have an investment business worth just over £1 billion and a pipeline of £5 billion. And we've just completed building an installation of Australia's largest solar PV platform. We'd love to replicate this ambition and success in the Middle East. And we're here today speaking and engaging with partners that share our vision for technology and innovation. So next on to ventures as the next part of my presentation. And I guess what we mean by ventures, so we invest in 5 verticals within innovation. The first is B2B software, second, consumer technology, third, deep tech, which is technology that will help solve problems of tomorrow, fintech, and then also, most interestingly from my perspective, health technology. We invest across various stages of venture capital, so all the way from pre-seed, which is idea innovation, all the way up to late stage and expansion and growth and exit, and we have a secondary strategy as well. As you can see, up until very recently, our most active area has been very early stage venture, but we're currently expanding this capability into later stage as well. And how successful have we been, I hear you ask. So we are the most active health tech investor in the UK and commonly in the top 1% across Europe. And so far across all of our ventures business, we've had the good fortune to back and work with 4 unicorn businesses, as you can see here. And I guess, why is health technology important? So in most of the developed world, we are living longer, but unfortunately not as healthy in our later years. Coupled with that, the inflation that we see within healthcare is some of the highest across all industries. So we require innovation that can help us standardize and improve outcomes irrespective of where an individual is based. We also require solutions that allow individuals to be more proactive and preventative to manage their own healthcare, rather than rely on an institutional approach, which is largely at the moment reactive as and when risk arises. So that's the human imperative. The economic imperative is today the health tech market in Europe is worth $50 billion, and we see that growing at a rate of 20% CAGR over the next 5 years. And a bit about what we mean by health tech. So we invest in the areas of greatest unmet need, and couple that with technologies that we see as truly transformative. We've categorized this into 3 main areas. The first is hyper-personalization of diagnosis for targeted treatment, decentralization of healthcare, and using technology to remove the friction and cost within the value chain. And very excitingly, but also quite scarily, we see many trends and similarities between some of the main causes of death and disability in the UK and Europe as we do in the Middle East. And we see huge opportunity to learn and adapt and transfer many of the technologies we've supported and invested in locally into the Middle East, not least those that focus on genetic disease, cancer, cardiovascular disease, fertility, and mental health. So I will stop there and hand over to my next panel member, but I wanted to leave you with 3 main takeaways. The first of which is we are purpose-driven, and we invest in the ideas and the people and the industries that will help us change the world. The second is that we're a long-term investor committed to bridging European and Middle Eastern healthcare via strategic partnerships. And the third is that we are the most active health tech investor in the UK, and we'd love to replicate that success in the Middle East. Thank you very much.
Thank you, Jess. Thank you very much indeed, Jess. And I thought there was a lot of resonance with what Jed was saying, and particularly around personalisation of medicine and fair access. So really interesting. And also I thought it was interesting that, that Jess's company, Octopus, has come from a sustainability base. And indeed, you're a B Corp organisation, which for those of you who are B Corp, you know how demanding that is. But a very interesting angle to come into health from. So without further ado, we're now going to sport. But not sport as older people know it. It's esports. Dave, tell us all about it.
Thank you. And thank you for having me here today. I'll keep this fairly brief. So I'm Dave Martin from the British Esports Federation. I just wanted to kind of caveat that by saying I'm here in a dual capacity. I'm representing today International Hospitals Group and the King family. So they've been 50 years in physical healthcare in 30 plus countries, working with 22 governments. In the endeavors that we work in, including esports, mental health has become a huge topic of conversation and a huge kind of pivot in the business models that we work across at this moment in time. Now, I have some connectivity to that. 6 years ago, I was working with the Chartered Institute of Payroll Professionals, and we got together as part of the Archbishop's task force to take on the payday lenders that were creating serious financial mental health challenges for people in the UK, where you're borrowing 100 quid, and if you don't pay it back at the compound interest rate, you owe about £1.2 million in 3 years, which was just a kind of crazy thing. And that kind of deep dive into understanding what that meant for employers and for individuals, on a very human level, there's a real impact. But for employers, we're talking about something like 13 million days lost a year in the UK alone around mental health, particularly related to financial health. So that's, obviously a huge issue. Looking further into that, as part of the group, we started to consider what the global impact of anxiety, depression, and some of these mental health challenges are. And there are some really interesting studies out there at this moment in time. One that came out a few years ago, actually, by the World Health Organization, talked about 12 billion days lost a year to these challenges, 12 billion days lost a year globally. So that's just obviously a huge impact. So from our side with IHG, and I'll come on to the esports bit for you shortly, we've got together with a couple of NHS trusts and a university in the Northeast to start thinking about education and developing education programs that we can deliver globally, and also kind of physical interventions in country that we can actually support. So I'm delighted, and if anyone wants to talk to me about that, I can. But just to keep it very brief, why esports then? Well, half the online world play video games, 3 billion people, nearly. Just want to put something interesting into context. Biggest box office weekend, Avengers Endgame, $350 million US in that weekend. Activision Blizzard, about to be bought by Microsoft for 70 billion, released Call of Duty, 2.5 million players in the UK, Modern Warfare 2, did 800 million at the box office. So gaming's big business, huge business. But what we're talking about with esports is competitive gaming. We're talking about human versus human, and we're talking about young people. We're talking about 15-year-olds in World Cup finals. We need to protect their mental health. We need to make sure that they can handle the kind of pressures that we're going to put under them, and that they're put under when they're at a competitive level. So the Federation was created to promote grassroots, to make sure we incorporate mental and physical health in everything that we do, that we talk about education, and that whole piece is embedded within the culture of professional video games moving forward. So we're delighted to say that with British Esports, we're putting a performance campus in the UK, and we have health and wellness professionals connected to that for both mental and physical health. Alongside that, just briefly as well to mention that I'm also involved in an investment fund, so if anyone wants to get into a really boring conversation with Jess and I about compliance, then obviously feel free to do so afterwards. But that's short and sweet from me. If anyone wants to talk, I'll be here for the rest of the day. Thank you.
Thank you very much indeed, Dave. Those of us a certain age, esports is, a great mystery, but I think Dave's illustrated very clearly it's a big thing for our young people, and it's really interesting to see an organisation, starting with Dave's journey in International Hospital Group, moving through to the Esports Federation, which is about how they address what they consider to be a vulnerability of their industry, which is mental health, and how they're actually addressing it positively and affirmatively. Really interesting. So our final speaker is from the Deep Knowledge Group. It's as mysterious as it sounds, but basically it's a collective of commercial and not-for-profit ventures looking at the real deep application of extreme technology, high-tech world, and about their application in the world. So very pleased that Talgat's here to talk to us.
Thank you very much, Richard, for such an introduction. Hello, everyone. Dear guests, dear organizers, it's a pleasure meeting you today. Today I'm delighted to represent Deep Knowledge Group, and I will talk about our initiatives in the Gulf region in the UK and how we aim to become a technological bridge between the UK and GCC regions. Shortly about our company, Longevity-Focused Analytics in the UK, Deep Tech-Focused Analytics in the UK, and our Gulf Region Longevity Hub initiative, as well as our existing partnership with Sharjah Research, Technology and Innovation Park. So what is Deep Knowledge Group? Deep Knowledge Group runs several data-driven investment and financial vehicles, such as Longevity Capital and Longevity Financial Advisors. Also, Deep Knowledge Group's analytical subsidiaries are world leaders in analytics for deep tech and longevity industries. In addition, we run philanthropy projects, pioneers in several infrastructural social impact projects. These are Deep Knowledge Group's analytics on GCC region. We produce and develop multiple reports to help private and public organizations to use our insights to make rational decisions. Life Sciences in the United Arab Emirates is a comprehensive analytical report which assembled information about key trends in the life sciences industry in the UAE. Report covers 420 plus companies and 90 plus investors active in the industry. This is the mind map, which covers comprehensive analytical information on multiple industries. We also developed a pandemic resilient cities ranking that shows and evaluates the continued progress of key cities and presents additional policy recommendations to rectify major shortcomings. The report is based on 6 parameters that city governments have been focusing on to prevent the spread of COVID-19. Here is the top 15 cities ranking. As you can see, Abu Dhabi is on top of the list. And the main points we used in analyzing is government efficiency, healthcare management, economic resilience, vaccination rate, quarantine efficiency, and cultural compliance. The report of agri-tech in the UAE profiles the overall agri-tech industry in the United Arab Emirates and delivers the key insights on the further development in the industry. Let me tell you a little bit about our existing partnership with Sharjah Research, Technology and Innovation Park. The key focus areas of this partnership is to map out the longevity industry in the country, fostering knowledge of relevant sectors locally and internationally, and to develop a comprehensive stakeholder engagement, identifying major drivers of the industry across the country, as well as developing a robust national longevity policies. We are actively present and covered in the media. Our general partner of Deep Knowledge Group, Dmitry Kaminsky, is a notable speaker about longevity, longevity governance, investments, and deep tech investments in longevity. He is present today as well, so please feel free to join us for any conversation. Longevity Industry in the UK 2022 report. It's a comprehensive report that, as you can see from the mind map, covers 3,500 companies, 2,000 investors, and 50 R&D centers. We also regularly produce longevity books and journals. You can find, we can share it with you today as well at our stand if you're interested to have a look. They are very comprehensive and provide lots of analytical materials. So I would like to introduce you as well to Deep Knowledge Group Longevity Industry Database. It's actually the largest in the world. As you can see from the map, it covers 73,000 companies, 1,200 hubs, and 20 segments, as well as 12,000 investors. Dashboards that are focused on digital and deep tech ecosystems in the UK, like GovTech in the UK Big Data Analytical System and Digital UK Ecosystem. They provide valuable information on GovTech industry in the United Kingdom. Now let's talk about our Gulf Region Longevity Hub initiative. The initiative seeks to unite the resources of several Gulf countries towards the shared goal of concerted longevity industrialization and to improve the public health and optimize and extend the healthy aging. So local initiatives will include local projects by utilizing technology to ensure longer, healthy, and more productive lives. Regional initiatives will focus on potential of the entire region directed on the achieving of maximum healthy longevity. And international hub will increase cooperation between longevity hubs all over the world to accelerate the development of longevity economy. Gulf Region Big Data Analytics Systems and Dashboards developed a specialized Gulf Region Big Data Analytical System and Dashboard. So what are the main features of the dashboards? It will include extensive database. It includes advanced market monitoring tools, AI-powered analytics, predictive analytics, user-friendly interface, and real-time analytics. So our aim, as I have already pointed before, is to establish the technological bridge between the UK and Gulf region. And we will do it using our deep tech expertise, AI-driven approach, big data analytics, automated matching, and investment optimization. Thank you very much for listening, dear colleagues. I will be happy to answer your questions, and please come and talk to us. Thank you very much.
Thank you, Talgat. Well done. Thank you. That's really interesting. And I thought, actually, it's not just the data, is it? And what Talgat was showing us was the interpretation and assimilation of that. So you can actually use it. I mean, that's the important thing. You can have as much information as you like, but unless it's interpreted for you, it's virtually useless. Now, look, we're going to have time for a few questions from the audience, but I just want to ask a question of this lot first. Then I will come to the gentleman here who's got the register in straight away. Look, I'd just like to ask all four of you very briefly, listening to the other three, what was the one thing they said to you as they were talking, you thought, crikey, that's something I should be working on. That's something that really interests me in terms of the whole business of health advancing and accelerating health between the UK and the Arab world. So who wants to take that first? I'm actually going to pause for 30 seconds so somebody can actually choose. I'm going to... Jess, do you want to go first? Yeah.
So when we think about investment opportunities in health tech, we often think about sort of healthcare system change and pharma system change, or like individuals as buyers. I think listening to the very aggressive expansion and growth within esports, the business models that will be needed to support individuals who are building their career in that space, I think are very specific, and hadn't quite realised the extent of growth that happened in such a short space of time. So really excited to learn more about that space after this discussion today.
Thank you, Jess. Dave?
So I think for me, when we start talking about data and different things, the government in the UK 8-9 years ago was talking about early intervention as a big thing. And I think that you have an opportunity here to be, when you're thinking about mental health and different things, to look at cost-benefit analysis. And, you know, like I said earlier, there's a very human level here. But there's another statistic that's really interesting. There was a report recently that was kind of extrapolated across 36 different countries. And it said that if you put the money in, you get a 5-to-1 return on your investment at early intervention in mental health. But really importantly, this was staggering. You would collectively have a combined 43 million years of additional healthy life across those 36 countries. I mean, just on a very human level, we've got to be thinking about. So this is where data to drive government thinking, to drive investment strategies at a government level and at, you know, be at a corporate level, investor level as well, become key.
Very interesting. Jed?
Yes. Actually, as per these interesting presentations, we may, as Tunisia, we may take profit of all this experience, this rich experience, especially the partnership between the UK and the Arabic world. And maybe we shall include Tunisia and the North African Arabic countries in the triangulation and to improve our legal framework, the ecosystem of telemedicine and e-health.
Thank you, Jed. And Talgat, what struck you?
Actually, for me, I think it was interesting to see how many angles are there in the healthcare investment industry. I mean, all of us essentially in the same industry world, but we do different kind of things. And listening to every one of the speakers was actually very fascinating because it shows you how diverse the industry is and how it attracts public investors, private equity companies, and so on. It just shows you the enormous amount of data of business in the industry.
And we're talking to people, I mean, in this room, and obviously people like the Arab British Chamber of Commerce. What could we in the London Chamber be doing more to facilitate those sorts of discussions? It strikes me, four of you have met for the first time. You've each been stimulated by what the others said. What can we as organisations do to help further those sorts of conversations?
Yeah, I mean, it's great to be, I think in the last year or so, to be actually getting back out and having networking opportunities and communicating, because without those, you don't get them. I think any way that you can convene knowledge transfer and sharing of knowledge and expertise, I think is really useful. I think, you know, the challenges we face in health across the board, we all face, and we all stand to benefit from. I don't think that this is, you know, perhaps when we think about other parts and other industries, we might be a little more closeted in terms of how we want to communicate. The healthcare challenge globally is one we all face. So how do we share good and best practice in the best way, and how could that be facilitated?
Yeah, okay. Anyone else want to comment on that?
Yeah, I agree. We need to facilitate more networking opportunities, but actually I think as well we need to convert it into something tangible. Maybe not like commercial partnerships, but maybe marketing partnerships and so on to facilitate and foster the knowledge about the industry and foster the sharing opportunities as well.
And Jess, you're always looking for new opportunities, but doubtless you get a shed load coming through by email every day and you have to fill. Is there a way that could be made more efficient and more effective?
Undoubtedly, yes. I mean, actually, what would be really helpful for us is the most often route for scale-up for health technology companies to date has been to the US, given the spending power per head of capita is far higher in healthcare. Actually, we see the Middle East as a really exciting geography, and would love to have more discussions and partnership opportunities whereby we can help those portfolio companies scale up in the Middle East. So actually, I think there's a huge discussion to be had around tech transfer and how we can enable and facilitate that. But to your question, like really, really happy to hear from anyone that's looking for funding from a health tech perspective as well.
Well, I think there's some work for Jed, you and me and the team here for Bandar and Abdul Salam from the chambers to actually get involved in that. We should be facilitators of that. Right, I'm just going to go to the audience. A gentleman here, and he's got the microphone. Brilliant. And before you start, there's a lady at the back who needs to get a microphone next to Richard Moyer. He's the one very well, poshly dressed. And I'm looking for one other person. There's a gentleman here as well. You first, sir.
Okay. Good afternoon. By the way, I'm introduce myself. My name's Richard Swift. I'm Program Director for the IAS Group, which I'll drone on about some other time. We're great fans of Aging Analytics, one of your companies, and absolutely excellent and most useful data. The area of health we're looking at is how to help older business people, and that means, I'm afraid, over 45, yeah, right, okay, where the age-related curve of the decline curve, both mentally and physically, is starting to kick in at the same time as the complexity of the challenges one has to handle are accelerating, and how this applies to SME owners, and particularly also in the Arab region to the owners of the dynastic companies on whom the economies are based. Mm-hmm. My question is, we're putting together a consortium on that. It's going quite well. My question is, are you aware of any other initiatives to specifically help older business people to cope with, to get well above the age-related decline curve in both mental performance, endurance, etc., to cope with these challenges? Because I'd love to talk to anyone who is.
Brilliant, thank you very much. I'm going to come to the panel. I'm going to take 3 questions and then bring them all back to you. So the lady at the back, you got your microphone? Perfect.
Yes. Can you hear me?
Yeah.
I'm Dr. Fatma Shakarchi. I'm a medical doctor from Baghdad, Iraq, and I currently work with the London School of Hygiene and Tropical Medicine. So I work in the field of digitalization of health and artificial intelligence. And when we talk about artificial intelligence and deep learning, how do we make sure that large populations, such as the ones in Egypt, so the population of Egypt is more than 100 million, and the population of Syria is more than 18 million, and the population of Iraq are more than 40 million, yet they don't have access to electronic medical records. So if we were to talk about deep learning and artificial intelligence, how do we make sure that those majority population that represent the majority of the Arab region are not left behind? Thank you
very much. That's a really good approach to the whole business of health equity. And then finally, gentleman here. Did you get a microphone? How come it went all the way over there? Not there. Good example of poor logistics.
Hello there. My name's Dr. Khan. I'm a GP locally in Marylebone. I work in NHS as well, and also have a private clinic in Harley Street area. My question to specifically Jed would be more towards the legal side of how internationally patients are regulated, because our plan as a consortium, we work through the Saudi embassy and also the royal family, a bit of royal family from Saudi as well, to have, kind of an internationally recognized patient care. So we, as GMC registered doctors from the UK, are thinking of at least having some sort of telemedicine to treat, basic medical conditions, which we do through nice guidelines here in the UK, but we wanted to expand more wider into Europe and also Middle East as well, preferably Middle East, as the summit as of now. So I was just wondering, here we're regulated through CQC, and internationally, how will it work? See, if I was to treat a rash or give a medicine internationally and liaise with a pharmacy there, are we able to actually treat them? Or how does the cross-border regulations work? So I think it'll be a good,
Really?
to globalize what we are achieving here.
Really interesting question. So it's almost an extension of the database question and the access to health questions. How do you cross borders in that? Really interesting. So I'm going to come to the three of you. So we've got three interesting questions there. First one I have a personally vested interest in. How do you keep people like me going? Second one is around the big health equity question. These are vast numbers. How do you provide access to health records in such a way as it can improve the health of millions and millions, tens of millions of people across the Arab world? And then the third area, which is probably, Jed, you're the lawyer, you're going to have to answer that. How do we move forward on the legal aspects of enabling cross-border medicine to effectively occur? Who wants to start?
I'm happy to start. So on the schemes and programs that are available to individuals over a certain age, actually we would see that as more of a preventative and proactive approach and problem to solve for. From a business model perspective, would far rather invest in a company that was helping individuals to plan ahead and prevent that from risk from materialising at whatever age parameter you want to target. Clearly there's reactive solutions that you can invest in, like be it wearables, monitoring devices that can help people in a higher risk situation. But actually from a business model perspective, I would much rather the company that we're working with and supporting was thinking about proactive healthcare. Clearly the more, the healthier lifestyle you lead from a younger age, the higher margin there is for overall improvement. So we wouldn't just tend to think about it as a older person's problem. It would be something that we would try and look at from a solution perspective early on, if that makes sense. I'm sure there are schemes out there that would be interesting to you, but I don't have any top of mind, sorry.
So,
Dave, yeah.
Being 44 and a half, I'm very close to that, but I definitely feel it, running a number of businesses, doing different things. I think the pandemic, being in and having 3 young children and not being as active as you can be, you can kind of sense that. If you read the Daily Mail, you could play 30 minutes of video games a day. Apparently, that's good for the brain. And there are actually some interesting statistics around that. But getting serious, I think there are a few things to think about. It interests me kind of where groups that existed, like Rotary and different things, what are they doing at the moment for businesses? What does those business channels do, IOD and others, think about in terms of actually supporting that to some way? I totally agree, it's a brilliant, fantastic idea, and if I can help in any way, then please let me know. But also, there's a comment about succession planning, and I think that becomes important as well. So there are, I think about Henry at Camden Wealth and some of those other places that actually, they run succession planning for family offices primarily. But I think there's a lot of lessons to be learned from those kind of businesses that are doing that at the moment, because what you've got to do right now is stimulate. And when I talk to families, ultra high net worth families, they say the young people are not necessarily as interested in the traditional investments they made before. They're interested in digital and creative technology-based investment solutions. So it could be about the business or the investments that family makes, diversifying in terms of a portfolio, and we see that portfolio diversification happen. So I think that's one thing. I think the second one is a little out of my wheelhouse, so I won't try and answer it, but the third comment about cross-border medicines is one that interests me and interests us greatly, because that's the same principle for mental health and how we treat mental health. And just looking in the different countries we're working in and starting to work in at the moment, what's there from a government level, what's there from a practitioner's level is different, and trying to at least have some normalization is incredibly important when it comes to education and delivering education interventions that support in-country development of these processes. And then also language is very important as well. You go to different parts of the world and different titles, different practitioners, and understanding of certain mental health conditions are just, they're not even in the language. So I would agree wholly that that's a big challenge.
I'm going to come back to Jed at the end, because I want to actually ask you about that in terms of North Africa acting as a bridge to the rest of Africa in a second, particularly over data and everything. But can I just ask you, Talgat, a bit about that big AI issue?
Yeah, actually, thank you, Richard. I wanted to answer the second question from the lady. Yes, I agree that we need to probably be more proactive to integrate and scale up the technologies in different kind of regions. And this is actually just a quick note. For example, a Deep Knowledge Group, we are moving in November, we are traveling to Dubai and opening a physical office in Dubai to establish this connection and to scale up those expertise that we built here, for example, in AI, in deep knowledge, in deep tech analytics, to scale up and find partnerships in different kind of regions, especially in GCC region as well. So this is why we establishing a physical presence and traveling there. So answering your question, like to scale this up and to really like to make it big, we need to be more proactive, to create more partnerships and to make some steps.
So perhaps you and the doctor at the back should have a chat after this.
Yes, absolutely.
Yeah,
please feel
make sure
free.
you grab
I would be happy to answer.
Jed, I mean, there's a legal question here, and I know that's your background, but is this an area where we can start looking at something which I know is a huge interest to you, which is the way, not just Tunisia, but North Africa can act as a bridge to the rest of Africa? And the problems around data and things are on the similar scale. We're talking about populations of tens and 20s of millions of people. So is there a legal aspect to that? And is there a route through that legal aspect that Tunisia could possibly help with?
Okay, actually, Tunisia is a double hub. Tunisia is a hub for African medicine because actually a lot of West African countries are closely working with Tunisian authorities to send patients to Tunisian hospitals and private clinics. I mean, in general medicine and other specialties. And it's a hub in another sense. It's the gateway to access to Africa because we have the know-how, we have the youth, we have actually the appropriate framework in terms of universities and hospitals and people who are very well educated and that are in a position to provide with the appropriate services. So now what we could consider to improve the legal framework, because actually with telemedicine, we have to forget about borders. Yeah. Patient and any African country could have a chat with a doctor in the UK or in Tunisia or in France. So actually there is a problem of trans-borders liability. Now, we cannot stick to any specific legislation in one country, knowing that there are two parties in both different countries. So maybe we have to push on to unify and issue standards, international standards within international conventions and push people to countries to sign those conventions to protect their own citizens. And this is how we could improve the international framework.
And I think you've actually stimulated something. I think we as the Chambers, looking at Abdul Salam there, we need to have a talk about this business of trans-border medicine, the legal aspects of that. Thank you very much. I just want to give you all just one sentence to say, what's the big thing you want everyone to take away with you from this session? So I'll start with Talgat.
From this session?
Yeah.
I'm just happy to receive some knowledge from the fellow speakers, and I would like to thank my fellow speakers for today. And the biggest thing I want to take away so people can be more proactive and continue to take the necessary steps to continue to develop the technologies in the healthcare especially. And if we keep doing that, I think we'll achieve major milestones in the nearest future.
Dave.
Early intervention is painful because it's an upfront cost and it's a return on investment over time. But we're starting to see examples of early intervention driving real value. So consider it seriously, and save yourself the money in the long run.
Jess.
For me, Europe is the most exciting geography for health tech. It's the fastest growing by valuations and total investment volumes, like year on year, and has been for the past 3 years. So if anyone in the audience is open to a conversation on why we're excited by it, and in particular types of technologies, really happy to have that conversation offline.
Jed, last word.
Okay, what I want to take from here, I want to take you all back with me, guys, to Tunisia. So we came like a delegation of 30 people. I want to especially thank His Majesty Ambassador to Tunisia, who is attending the event. She came especially from Tunisia. So we wanted to visit just to see how the medicine and telemedicine has been improved since the last years. Thank
Right,
you
so the next time this panel should assemble is in Tunis. Absolutely guaranteed.
We will work on it.
I just want everyone, thank you, Talgat, Dave, Jess, and Jed. And thank you very much indeed. Cheerio.